My name is Anna Marie Sinatra, the CEO of Sinatra Solutions, a coaching, consulting, and training firm that partners with you to catapult you to the next level in whatever it is that you're up to. Whether you're an individual that wants to sharpen your skills professionally, maybe it's leadership development, maybe you're the owner of a business and you have employees that you have to manage, maybe you're a manager, we can do that together. And if you're a business or an organization and you want to create those peaceful working atmospheres where your employees can work together as a team, we can do that with diversity training and conflict resolution and soft skill training. We can do it. We can partner together to get you where you want to be.
Hi, I'm Ava Sammarco, the Practical Nurse. I enjoy bringing you current and up-to-date health information for today's changing world. And I do this by hosting Health Focus.
And I host Health Matters.
And we collaborate to bring you focus on health matters.
So before we get started, we want to thank some of our sponsors. We want to thank Mattress and More, where Maddie Mattress is educating us in a variety of ways on how to get a restful sleep. You could never believe there's so much information when you're looking for a new mattress. If you have problems getting a good night's sleep, maybe you have some injuries like I did, knowing all the different details about those mattresses is so important, and he's doing such a fine job in educating the community.
Go right to sleep.
Yeah.
Also, we'd like to thank Western New York Imaging Associates, Dr. Frank Mascaro, providing state-of-the-art imaging equipment to assist you in your time of need. With many locations throughout Western New York, Kenton MRI, Lockport MRI, and Western New York MRI, downtown Buffalo, and his equipment in several other facilities throughout Western New York. Yeah. You'd be surprised.
Yeah, you would be. He's like all over.
Wow.
Yep.
Great.
And we want to thank Joe DeMarco from Wings Flights of Hope, where his volunteer pilots are flying sick children and people all over the United States in their time of need, whether it's a transplant service or, somebody gets that call in the middle of the night, and God knows if you had to call the airlines, you pay a fortune. They have volunteer pilots that stay on call waiting for you to call them. So without any further ado, you want to tell them about making sure they got those pens and papers.
Pens and papers.
So let's you take lots of notes and let's get started. Boy, do we have a surprise for you today.
Yes, we do.
Ava is not just co-host today, but she is wearing, is that a hat?
Yeah, that's a hat.
This is a hat?
I'm trying to.
I thought you were doing something else. I won't say what, but I can't. Okay. She's wearing two hats today. She's co-host and she's part of the guest today.
Yes.
Yeah,
a little different today, but I think we'll do fine.
I think it's going to be amazing because we've done this before when we've talked about my business, my coaching and consulting and training business, Sinatra Solutions, and I think it's always good to have you talk about all that great stuff that you're doing in the community too.
Exactly, and today it's all about nurses.
Wait a minute, no doctors?
No doctors.
No Dr. Mascaro, Dr. Sergani?
Nope.
Uh-oh. The nurses get a chance.
The nurses get a chance today.
That's a good idea.
Yes, I am so happy to have on our show Laura Lee Sassana.
Thank you for having me.
Thank you for coming, Laura Lee. And you both are part of
the Western New York chapter of the Holistic Nurses Association, right? And the main organization is in Phoenix, I think, or did they just move? Well, it's out in Arizona. And we've had really, good luck with the Western New York chapter. And it focuses on holistic nursing. And holistic nursing, being holistic, really you take in the whole person.
Body, mind, and spirit.
So, yes.
Body, mind, and spirit.
Because, we're all connected. And that's when I think it's unique. But nursing is holistic in itself. But the way I look at it, too, is that holistic nursing, too, could be like it's a specialty in its own. Right? Because we're just, as you focus and as you're learning to be a nurse, it's very, very important to focus on those I call them spheres of life. It may not be a sphere, but
yeah, but it's true what you say though, because oftentimes our doctors and our nurses are
Right.
educated and trained in just the medical aspect. And there
Exactly.
may be, I don't know, because I obviously didn't go to school for it,
Right.
but the focus more has been trending for the last maybe 10, 20 years,
Right.
slowly crawling towards the holistic aspect, as we know, but for working with so many people with this program, and then me and my business as well.
Right,
But
instead of
it's so
being
exciting.
disease focused, you know.
Exactly.
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 Preventative measures.
Yep.
You know, instead of just, not curing, but helping a person along. You know, treating somebody. What do you think, Laura Lee?
Oh, definitely. I think surprisingly holistic approach to healthcare and healing is nothing new. I mean, this has been around for thousands of years, and it really hasn't been until probably the early 80s that it started to come back around here in the United States to really start implementing a lot of the holistic therapies and modalities that have been used throughout those ancient, throughout ancient history, the acupunctures, the
Yes.
reflection, the meditation, all that stuff. So it's really nice to see, healthcare coming back to the roots per se, of where it really began,
exciting.
and really starting to look at people, patients, human beings as being more than just a physical entity. We are
Right.
more than just a physical being.
It's
Exactly.
just so exciting to hear you talk about it. When we were talking in the green room earlier, you were talking about all the research and the education that you're doing, because I remember a long time ago working with a nurse who was so frustrated. She's
Yes.
not in the, we both know her, she's not in the medical field anymore. She actually left and started her own business because of, it was so difficult to try to cross over some holistic schools of thought over to the actual medical side, working with doctors. So tell me a little bit about your research and the stuff and the education that you're doing to help that to, can I still say slowly bump along, or are we moving a little faster?
Yeah, it's very, it's nice. Ever since I was a little girl, watching family through sickness or whatever, I have always been attracted to this whole thing of taking care of people. And the more, you dealt with sick people and saw sick family members, there always seemed to be something missing to me. You saw the physical things, the nurses came in, you got a bed bath, you got your meds, you got whatever, but there was
Right,
something
yes.
just missing. So as I got older and started watching, more TV and whatever was going on, it really was apparent that we're missing something. We're missing something. So I've had this thing with me ever since I was a little girl of taking care of the whole who per se. So as I was going through nursing school, that's really what my focus has been. I did get my doctorate from the University of Buffalo, and my program of research is in spirituality, end-of-life care, and holistic nursing.
That's beautiful.
I do a lot of qualitative research, which is, talking to people and interviewing them and finding out what makes things work, and I really love that part. I'm really invested in the teaching part too, because I think with nurses, if we can reach them from the very beginning and teach these nursing students, our future nurses, that we are more than just a physical being, and how to walk into that room and just
You have to
automatically
listen.
do it. Yeah.
Or take the time. I know the medical model forces us, not to, hurry up, run to the next patient.
And
This
then what
one,
about the
this one,
insurances?
Yes.
You get this much time with each person, so they got to roll them out.
Exactly.
So
Exactly.
frustrating. So
Whereas
how do
you
you
need to
do
listen.
that then? How do you do that when you're up against all of the things that...
Exactly. That's what they're trying to establish. That's what they're trying to work on, because you need to listen, to your patients, because it's not just one thing. It's a multitude of things, and something else could be contributing to something else. Something could be emotional, which is triggering a physical symptom.
Right.
It could be triggering that. So sometimes, like you said, like Laura Lee said, they get missed. And then, what happens is, and sometimes somebody's illness might get worse.
Yep.
See?
Yep.
I think just it's really important to take this approach that being a holistic nurse it's an approach to how you do nursing care. And we all approach it in different ways because we're all different. But it's just walking into that patient's room and being open to different things with
right.
that patient. I mean, a big part of holistic nursing is really understanding that the patient is a co-pilot or a partner in their care.
Yes.
They're not, controlled per se or whatever. I think that's been a big barrier because there's scheduled, bath times, med times, whatever.
Right.
So it's really hard for nurses to walk in and say, okay, I want to come in here and listen to the patient, and they don't want to shower at 7 o'clock in the morning. They want to wait until the afternoon, but they got tests coming up. So really, how do we do all this stuff? But if we could just start being a little more open-minded and respectful of those kind of things. And when I teach holistic nursing with my students, it's really, like I said, it's a philosophy, because everybody's like, well, what are the steps? How do that task thing starts coming up. You need to tell me, what's step number 1, step number 2, and it's like, it's a way of being, it's a way to approach your nursing care, and it's just understanding, again, that there's more to a patient than this physical entity. So, when you walk into a patient's room, I really expect my students to look at that patient. The very first thing is to address that patient. Good morning, Mr. Smith. How are you today? My name's Laura Lee. I'm going to be your nurse for today. Really connect with that patient right from the beginning, and then start looking at things and what's going on. And as you're taking care of the patient, talk to them. Communication is huge in nursing. That's how you get a good assessment. You ask questions, you watch body language.
Right.
There's more
Exactly.
to it. So I think if you can really start teaching those kind of things, and how to be with a patient when you walk in a room, and get away from the complete kind of task-oriented thinking, I think that's a good start.
So how do you then address with the students, that's the one aspect of it, how they talk to their employer, whether it be a private practice or a hospital or a nursing facility or extended care, whatever the situation is, to enroll those people who haven't even had this education, because these are the people that I'm coaching. They come to me and they say, how, I deal with everybody's minds, how they're thinking, how they're perceiving, how they're responding, reacting versus responding, all kinds of things. So I deal with what's up here. You're dealing the whole physical. So I understand the challenge that they have in talking to the doctors, or in some cases, some of these medical facilities are owned by people who are business people. They
don't understand the patient-centered concept.
Yeah, I think that whole concept of patient-centered care, it's really starting to take off, and I do think that we're starting to do a better job and spread that awareness. And I think things like the alliance that we started here in Western New York, that's a great start. And it's not just open to nurses.
Nurture yourself too.
We welcome all disciplines can come and sit in and share, because that's how you grow and learn. So that was a really good question, because I think nurses really spend the most time with patients at that bedside. I think if we can show by doing and talking and explaining and just start spreading that awareness, I think that's going to get better. If we can really truly advocate for our patients and be our patient's voice, which is really our number one job, that's how it can work. If we just keep going along with a broken system, nothing's going to change or get better.
Right,
we really have to be that change. Really be the change you want to see. That's one of my favorite quotes.
Yeah,
you really have to
be the change you want to see in the world.
Exactly. So I think that's the way to do it. I have an example, if we have time for an example.
Sure, absolutely.
I was doing an internship at a local hospital, and this gentleman was told that he only had a few short months to live. He was an older gentleman, and very concerned. He had grandchildren, that he didn't finish birdhouses that he had started with him. He went from a doctor's office and was admitted right to the hospital unexpectedly. I was working with a pastoral care team trying to learn spirituality and, enhance my background in that. And we walked into his room, probably the third day. The only topic he would talk about was those birdhouses. He was so focused that, I have these birdhouses and my grandsons, what am I going to do? And I didn't finish, and it was a legacy, and I want them to remember me by these birdhouses. That's all he could focus on. So, after I said, the third day, I think we went in to visit, I did grab a social worker. And I said, man, you really have to go and visit this gentleman and talk to him. He's concerned about these birdhouses. Is there any way we can bring the grandchildren here? make a
Beautiful.
room, do whatever so he can finish, because he's stuck and he can't move on with what he needs to do in the work, the end of life work that he needs to do, because he's stuck here.
Yeah.
And they did.
Oh.
They brought in his grandchildren and he finished those birdhouses and he was able to move on to other things that he needed to work on
Because it was
himself.
unfinished business. Yeah.
When you say you have to listen, that's an example. I think another holistic kind of philosophy is to listen not only with your ears but with your heart. That's a good example of what that
really
is.
good
You have to be
example.
open to those cues and see we do have the power to change those things.
That's right, we do.
And it took just how much time did that take? It really didn't.
Exactly.
But you were listening and paying
So
attention.
what kind of, besides the students then, what kind of things are you doing in terms of reaching the owners of medical facilities and the doctors? Are you doing some trainings? And tell me more about the organizational
The organization? Well, in our organization, our chapter, we teach ourselves to nurture ourselves as well. Because, well, nurse means to nurture. That's where it comes from. And there's a different theme every month. We have them once a month on the fourth Tuesday. And our president, Lori Logman, we usually have, like, for instance, one time, no, 2 times you did. You gave, Lori Lee gave a presentation on holistic nursing. We usually have we usually have serve fruit. We don't, and we're very good, V8 drinks, where we don't have any calorie counting, and water too.
Water.
Sorry out there. And it's really helped because, you learn too about these alternative modalities. You know what I'm saying? To help yourself. And what we want to do is we want to reach out to the community. This is what we're working on now, like in nursing facilities, doctors' offices, to start the spread of holistic nursing and the concept, to try to put across to people the patient-centered model instead, versus the medical model. Now, this is going to take time because it's not going to, as you know, it's not going to come overnight because we're so centered, like Laura Lee said, in the task-oriented and in the medical model system.
I want to interject because I want to ask you, so when you're doing these meetings and you're providing workshops or presentations, are you inviting the public to come in and watch, or do you key into just medical facilities, doctors, potential students, or people who are students? Like, what is your focus so that people who are watching today will know, you know, if they fit into that?
Yes. Well, again, I have to reiterate what Laura Lee said, anyone can come, really. What we'd like to do too is to reach out to the nursing students also. We had mentioned that before, remember, Laura Lee? Because sometimes you're taught the tasks of nursing school, your shots, you're this, you're that, blood pressures, things like that. So in the future, like what we're doing is we're working on now is to go to the nursing schools too. And in people in the community too, like we can, do some maybe clinics or things like that to let people know, what's out there and how, how it can make a difference in their lives,
That's beautiful. And of course, being co-host of our show, you see the value in doing the show and doing radio. You're doing a lot of radio. So if somebody's watching today and they have a radio program, they can invite you two on, and people can call and come to the meeting. And if you're an organization, you can set up a presentation, and so there's all kinds of possibilities.
Oh yeah,
just about anybody who's listening today and watching today.
Every fourth Tuesday at Macaulay Seton nursing facility, and that's on Military Road in Kenmore, or Kenmore, Tonawanda, right in back of Kenmore Mercy, as a matter of fact.
At what time?
At what time? 7 o'clock. Fourth Tuesday of every month. I so look forward to those meetings, and they're a wonderful group of people, of nurses and people. Yes.
And I know that I've met you out in some of the in the summertime when there's lots of festivals and things going on, that you get the word out that way too. That's another good venue.
Oh, definitely. I think attending the health fairs and trying to get our word out that way, that's really important. I don't think nurses really give themselves credit for how much we know and what our expertise is, and it's really sad because we all do these different jobs, we all have these talents, we all have different certifications and different things we do, and we don't give our I don't think nurses give themselves credit for being professional experts in patient care. There's so much we do. There's so many different kinds of nursing care. There's so many different places. There's so many different therapies and modalities. I mean, just being part of the organization, the Alliance, I've learned so much just from other nurses coming to meetings. I mean, it's impossible to know everything.
Right, because everybody comes from a different background also. And we share different things that may have happened.
I'm speaking my language again. Collaboration,
exactly.
more collaboration.
And they're actually teaching, I love that, because you're constantly learning about the different therapies and things that are out there. It's amazing. It's really exciting, and it's amazing. So I'm just so grateful that this alliance has been started, and it's a good way for us to get together and really talk about what we do and promote what we do and how important patient care is and how many different ways of care there can be, and educating our patients that there is meditation, there is journaling, there is reflection, there is we can do all those things, but I don't think they understand that.
Exactly.
And the demand for holistic care is going up too. People are noticing that something's missing. So we do good work. It's just a good way to promote the good work that we do.
I think that's pretty awesome. I'm excited about it. Because I know how many people we interview and how many different organizations there are. It's almost like you could even partner with some of the other ones and share your resources and your talents.
Yes.
And one of the things I was thinking about when you both were talking, that in healthcare, a long time ago, they didn't even recognize acupuncture and massage therapists.
They didn't.
Or even chiropractors. Yes. So we are, limping along, and maybe it's like that 100th monkey syndrome. Once it starts to catch on, we'll go boom and go to the next level with it. That would be really nice.
That would be great.
Because there's so much, and you had said it too, because there's so much out there. And the more that we learn, the more it seems to come in. We've had so many different guests on about so many different modalities.
Yes. Yeah. It seems like it's endless. Really, it does. And that's what's so good about nursing too, is because there's so many avenues you could take. And this is one avenue that I love holistic nursing. So,
definitely.
And it works out really well too.
And I really like the piece too with the Alliance that we are learning how to take care of ourselves too, because you have to be in good mental, physical, emotional, and spiritual shape.
Exactly.
Before you can really afford. You're really able to do that, because nursing's hard work. And I always say to my students, how many of you, raise your hand, when you go home after clinical, how many of you are mentally, physically, spiritually, emotionally just wiped out and drained?
That's when you call your very own personal executive coach and motivator to help to keep you.
Come on, you get through it now.
That's working on what's going on in between here.
It's coming.
Helping you to look at things another way and to keep
plowing forward.
It's just because if you
plowing through, here we go.
It takes all of you to take care of all of them. So you really have to take care of yourself. There's a huge problem with burnout and compassion fatigue and all those things that we hear about and read when nurses don't take good care of yourself. So you'll find something, your little niche for yourself, a holistic thing, and really start. That's a good way to introduce yourself to therapy or get into it. Pick one thing and try to learn about it. Try to practice it.
I have a question for people who are watching today. Give each of you just a couple of hints, a couple little of your tips on how to take care of yourself, because we could all use more of that, right? We could all use more of that.
Yeah. It's a lot harder than you think. You have to be honest. In today's world, there's time constraints. Our work is very difficult. I think, again, it's how you approach it and do things like on your way home, I listen to music. That's a good wind down thing for me. I sing and I listen to music. I love doing that. I also read a lot. I love to write. I love to do all those things. That's my quiet time, and to make sure I set aside time for those things. That's really important. Yeah, and exercising.
And exercising too. And Ava, what are your nurses' notes? Nurses' tips?
My nurses' notes? Listening to music in the car. Actually, what I do is, and I shouldn't do this, is I turn it up I crank it up to the oldies, especially the 70s, you know, and going like that. I love walking. I'm starting to walk around the block and everything. What else do I do? Cooking, but I'm starting to cook things that are better for me, you know. And for instance, I'm having wheat pasta now. You imagine my relatives. You imagine the wheat pasta.
Not hearing that.
I know.
Well, actually, because you know, I just gave up pastas. Anything white. There's my tips. There's my
But you
health
can have
tips.
wheat pasta, right?
Depends. Anything white. I've given
That's
up anything.
right.
I do not eat anything white. The only thing I love my sweets, so I use stevia, only stevia. And but not from the health aspect, the physical. I'll give my tip is get out your scheduler, whether it's a manual or whether it's electronic, and schedule time with yourself.
Absolutely.
And that's very hard to do sometimes. But you
I
know,
have to put it
now-
right in there. Meeting with AMS, and I know that means me.
Like a debriefing. Okay, okay, here I go.
Exactly.
It's the end of the day.
Yeah. Well, you know, we are like just about at the end of the program.
Can you
Time
believe that?
flies. So I'm wondering, you know, if there's anything that we didn't get to that you two nurses in the house, wanted
Nurses
to
in the
get
house?
to.
I just want to mention too that Florence Nightingale was the first holistic nurse. We must
she was.
we must mention good old. She's affectionately known as Flo. When was that, in the 1900s? Was it?
Wow.
Oh
1860s, 1880s.
my God!
Yeah.
Yeah,
Yeah, and
1860s.
she's considered the first holistic nurse.
She's a
the founder,
pioneer.
Yep, the founder of modern nursing. Yes.
We had holistic. Wow. I thought I was ahead of the game. I feel behind now.
She was really, that's a whole other topic. That's a
Right.
whole other
I
show.
I just wanted to mention that real
Yeah.
quick.
Yes,
that,
yes.
Yeah,
you know.
she's an amazing lady.
Well, anything else? Anything else that you want to get out there in this last?
Well, you can, give us a call,
Yep.
and it'll be on the bottom of this, screen, and you
Yep.
can give Laura Lee or myself a call, and feel free to come and, join us.
And keep watching the program. And thank you both for coming.
Oh, thank you.
And we thank you for
Coming,
your
I'm not-
emails.
No,
For your coming, what?
no,
Huh?
I'm
What?
here anyway. No,
Oh, yeah,
just
you're
kidding.
here. She's here anyways. That's what we were talking
Okay, I
about.
remember today.
Well, thank you for making sure that this program
Okay.
happened. How that?
All right,
How's
that's
that?
better. Okay.
It's been a long day. I need to schedule some time for myself
Yes,
tonight.
yes. Yeah, I think so. Me too.
Yes, absolutely. But we really appreciate your emails and your text messages and your calling. And if you're a holistic practitioner, make sure that you reach out to us to be on the program. Learn out how you can be on the program, and reach out to Ava and to yourself. And the numbers have been at the bottom of the screen because we want to hear from you. You got to get involved. Remember that my other favorite thing is, how do you eat an elephant?
I need an elephant.
One bite at a time.
Oh,
So if a
okay.
project feels overwhelming, you just start with one small step. I guess eating an elephant wasn't the best thing. So until next time, remember, your health matters.
So stay focused.
So thank you for watching. We really appreciate your emails and letting us know
Yes.
that you like all the programs that we're bringing you. We want to know if you want to be interviewed on this program too, so keep those emails coming. And we have a couple more sponsors to thank. We want to thank Mr. Frank's Barbershop and Beauty Salon. Yeah, you heard me, Barbershop and Beauty Salon.
Wow.
This used to be her dad. She's been there forever. And then she became a beautician. And now her father has since passed. And she stays there on that corner, providing all kinds of services and educating people on hair care. And she does medical pedicures. So as you start to get a little,
Wow.
when you start to get a little older and you can't get down there to take care of what needs to be taken care of,
Yeah.
there's ways you can do it.
Wow, that's neat. Wow. Also, the Healing Spa with Marge Reed offers holistic, non-surgical facelifts, facial chakra balancing, color and light therapy, and many other therapies, helping to bring the body into balance wherever it is needed.
So keep watching, keep emailing us, and stay focused because
Your health matters.
see you next time.